When should you start taking statins for high cholesterol? If you have been wondering about when to consider statins for high cholesterol, you are not alone. Many people face this question as they navigate their health. Statins are medications that help lower cholesterol levels, specifically low-density lipoprotein cholesterol, often referred to as bad cholesterol. Generally, adults aged 40 to 75 with one or more cardiovascular risk factors should think about starting statins. These risk factors include high cholesterol, diabetes, high blood pressure, or smoking. If your estimated 10-year risk of cardiovascular disease is 10% or greater, it is advisable to start statin therapy. This can significantly reduce the chances of experiencing heart attacks or strokes. For those with a 10-year risk between 7.5% and less than 10%, statins may be offered selectively. This decision often depends on individual risk factors and personal preferences. If your low-density lipoprotein cholesterol levels are very high, specifically above 190 milligrams per deciliter, or if you have familial hypercholesterolemia, you are considered at very high risk. In these cases, statin therapy is usually recommended, regardless of calculated risk scores. Adults with diabetes aged 40 to 75 and low-density lipoprotein cholesterol levels of 70 milligrams per deciliter or higher should also consider moderate-intensity statin therapy. This recommendation stands even without calculating the 10-year risk. Before starting statins, it is essential to consult with a healthcare provider. They will evaluate your overall cardiovascular risk, taking into account factors like smoking, blood pressure, diabetes, family history of early heart disease, and lifestyle choices. Sometimes additional tests, such as coronary artery calcium scans, can help guide this decision. Statins are typically considered when lifestyle changes alone do not sufficiently lower low-density lipoprotein cholesterol. If your low-density lipoprotein cholesterol remains above 100 milligrams per deciliter, especially if you are at high risk for cardiovascular events, it may be time to consider medication. The goal for most individuals is to reduce low-density lipoprotein cholesterol to below 100 milligrams per deciliter. For those with a history of heart disease or very high risk, the target may be even lower, below 70 milligrams per deciliter. In summary, the decision to start statins is based on a combination of age, cholesterol levels, overall cardiovascular risk, and the presence of risk factors or conditions such as diabetes. This approach aims to manage high cholesterol effectively and prevent cardiovascular events.